So there's another patient I'm going to talk about, and I'm going to bring up an article because it has to do with cancer and immunotherapy. So prior to me becoming a cannabis nurse, I've been an oncology nurse. I worked at Dana-Farber, Children's Hospital, Brigham and Women's, at Beth Israel in Boston, and actually did home care, mixing chemo and giving it in the home. So it was very, very interesting for me, to be working with patients, not only in the conventional system that didn't have access to cannabis, but now those that are actually reaching out for cancer cannabis care that are also using conventional care and mixing them together. Mm-hmm. So there has been some controversy and with research and studies around the use of immunotherapy with cancer, right? Mm-hmm. I'm going to pull up that article and I'll let you start talking.
Okay. You share a screen.
Yeah. Here we go. Cancer and immunotherapy. Here we go. All right. So this is from Project CBD.
Yeah. So Project CBD is a great source for all things cannabis science and medicine. And so with respect to using cancer and chemotherapy and just pharmaceuticals in general, right? What's safe? How do we use these things concurrently? And are they compatible? Because, the overarching conversation with respect to this is we're activating CB2 receptors with cannabinoids, with THC more specifically. And that could be immunosuppressive, right? And when you take immunotherapies, these checkpoint inhibitors, that they're trying to inflame the immune system and they want to rev it up so that we can get the cancers to get back into apoptosis and autophagy and digestion and removal, essentially. So cleaning them up and getting them to go out of there. So if we're trying to have the anti-inflammatory effects of cannabinoids, are we inhibiting the efficacy of the immunotherapy? And that's always been the question, right?
Right. Because the endocannabinoid system modulates the immune system, right? So the endocannabinoid system naturally either dials up the immune system or dials it down.
Yeah.
So when we're introducing pharmaceuticals such as immunotherapy that has a targeted response, we need to make sure that we're maximizing that specific therapy as opposed to minimizing it and not allowing it to work as well. So prior, there were some red flags from the earlier studies, right? There was worries about the incompatibility of these two treatments using cannabis with immunotherapy, right? Because of that CB2 receptor activation.
Yeah. And when they went back and truly analyzed these studies, what they were finding is that the ones that were offered this were given them concurrently shortly before death. And that was really the biggest outlier. So, giving somebody that literally is almost dying, these concurrent therapies, the immunotherapy, you bring that in and use the cannabinoids, it just was really shortchanging the system. And the high burden of disease was prohibitive of really having a good shot at it.
Right. So in other words, the bottom line is that they did the study on patients that were dying. So they were so sick that it didn't give them the opportunity to truly utilize both therapies together.
Yeah, right. And all of the other studies since are finding that there's parity. There's no difference statistically in the survival rate and the tumor shrinkage. So in using the therapies concurrently, we're not losing anything. And again, it goes back to monitoring. So it's okay to be using high THC, but maybe keeping the dosage low.
Right.
And so we recommend 25, 50 milligrams tops on the THC side.
Yep. Taken over, various times.
So, and different dose times. And of course you want to space them too, right? Don't give them at the same time.
Yeah. So what I really like is our data suggests that the use of cannabis concomitantly with immune check inhibitor, so immunotherapy, does not reduce treatment efficacy. The authors conclude, with the increasing use of medical cannabis worldwide, this finding is of major clinical importance.